Norton, member of the Oversight and Government Reform Committee. Ma'am, it's nice to see you. Welcome.
Thank you.
So, Chairman Issa there, do you agree with what he has to say? Does someone have to go?
Well, if someone has to go, a closed question is the secretary. The president says she's not going to go. Perhaps some of the contractors should go. They've done an important thing. They brought in a master contractor to coordinate these matters. I wonder why they didn't have one before. But we can't let the bad news about the website overwhelm the good news about health care benefits for 48 million people who either had none or had unaffordable or inadequate plans.
Okay. So I take it that you agree with the governor of Kentucky, whom we heard a little soundbite from Meet the Press. He says, look, you just got to relax. Take a deep breath. This is a large rollout. Or do you have some pretty significant questions about the rollout?
Well, I do, and so I think it's fair game for the Congress to weigh in to see what's happening here. But understand that so far you've heard from a committee whose members almost uniformly opposed any health care reform at all. You got to have people fix it who at least believe in what we're doing. And I think that with this November 30th fixed date, it's really interesting because given what has gone wrong so far for Jeff Zients to come out and say he's Mr. Fixer, that it's going to be fixed by November 30th, must mean he sees the problem, knows how it can be fixed. So I'm leaving it to people in the administration who know how to find who didn't do what they were supposed to do and have found somebody who says he knows what to do now.
Okay. And as you see, Mr. Zients saying that clearly it appears that he does know what the problem is, since he has given that date, as you say. But Chairman Issa, he continues to subpoena HHS for documents about this website and all the contractors who've worked on it. So how far do you think the investigation should go?
Well, when of course when the House is controlled by Republicans and I'm on Chairman Issa's committee, he is obviously going to look for culprits here, and that's what that committee does. I don't think he's going to find it in the underlying plan, and that's what bothers me. I think what we ought to be doing now is building confidence in what has not lost confidence, and that is the plan itself. And we don't want what has happened with the website to step on the good news about the plan, and I'm afraid that if we don't build confidence and focus on that, we will have real issues. And we know that we don't have real issues now because people crowded to get onto the website. So we know people are excited about doing that. We want to, frankly, keep that up. The way to keep that up, and I don't know why they didn't have the 800 number and as a backup before, or even paper to be old school about it. But now that they have it, and now that it's reported that you can call, I mean, somebody called just before I came in and said they could get on. I do want to leave you with one thing that's very important. The Bloomberg News cited 4 jurisdictions that had smooth rollouts. One of them is the jurisdiction that all of members of Congress and their staff are going to go on January the 1st, because unlike any other group who has an employer who funds them or who has a website, or sorry, who has insurance, members of Congress we're told they have to go on to a site like everybody else. Smooth rollout with DC Health Link. So and that's going to be a real test. Yeah. One of the 4 jurisdictions that got it right.
I'm curious, though, when you were talking about some of the issues. So are you disappointed? Are you surprised by how this rollout came about? And do you think the president holds any responsibility for it?
Well, I am disappointed. You won't find a member of Congress who's not disappointed. The extent of the problem surprised me somewhat. I am never surprised when there are multiple glitches online. I really am not. We see that even your Social Security number can result in a massive glitch from the private sector. The responsibility the president always has to take, and he's taken it. When is the last time you saw a president go on the air to talk about fixes in a website? That's taking responsibility. That's taking responsibility.
What about information? Because the White House has given very little of it to the public about the number of people who've enrolled on the federal exchange. They've been pretty forthcoming to you and your colleagues in Congress, have they, or not?
to tell you the information, to tell you the truth, there's very little information, I think, that they have. But let me tell you why. It would have been very misleading to tell us, quote, how many people have been enrolled. People have been shopping around for health insurance as they've never had to do before. So they would be silly to start enrolling immediately. And if we look at the only experience we have, in Massachusetts in the first 3 months, they had 6% of the people signing up within, by the time you had the fines came in, they had gotten past 90%. And I think that's the model we must look to now.
All right, well, looking ahead then, Democratic Congresswoman Eleanor Holmes Norton, nice to see you. Thanks so much.